Good morning, everyone. Thank you for having me here. My name is Tensae Getz, and I am from Office of Health Equity. I'm going to give you guys a little snippets of what our office does to tackle health disparities in the Commonwealth. The mission of our office is to provide leadership to promote public awareness of health disparities, advocate for programs to eliminate health disparities, collaborate with stakeholders as yourselves, and collaborate and achieve measurement and sustainable improvement in health status of underrepresented populations. So in order to tackle those disparities, there are a couple of task forces that comes out of our office. One of them is the Pennsylvania Interagency Health Equity Team. We convene common health leaders and to end health disparities by building capacity to create policies and programs cultivating relevant models of actions, and that we meet like monthly for that. This includes numerous Pennsylvania departments such as DHS and Department of Transportation. And the other one is the Anti-Racism Health Equity Task Force. The purpose of that Anti-Racism and Health Equity Task Force is to lead the department's health efforts to become anti-racism institution and be mindful the historical disinvested communities to achieve health equity and inclusion for all staff and health equity in the Commonwealth as a whole. The other one is the Regional Health Equity Action Team. This one has over, I think by now we have like 400 members. The regional one, I'm pretty sure they meet monthly. And as of January, I think I said like 380. I think it's over 400 by now. There's an open door policy during this process, so feel free to join if not already involved. You can join based on where you're geographically located. The same group, actually, there is a statewide HEAT one. This Office of Health Equity, Statewide Health Equity Action Team, this one meets virtually every other Thursday, 10 to 11. The group includes a wide variety of internal and external partners who have all strong interest in reducing health disparities across PA. And the organizations that are involved are academia, healthcare professionals, state agencies, nonprofit, foundations, faith-based organizations, and many more. There's like, I think, over 500 individuals that participate in our the statewide HEAT. And the meeting includes like 2 to 3 presentations from different groups. They could be external, they could be internal from the department, from various departments on different health topics to address health equity. And they each probably get like 10 to 15 minutes to present if there's 3 of them presenting in one day. And there's like follow-up questions if we have time. The other one is we do have the partnership and collaboration team also. We work with nonprofit and faith-based partners. We are working to expand upon existing partnerships right now, as well as forging new ones to address the needs of the most vulnerable communities and throughout the Commonwealth. So there are several initiatives that are underway currently and are prepared to be implemented. We are also collaborating with the Rural Pennsylvania Outreach Partnerships. There is the Rural Pennsylvania COVID-19 Toolkit, so please take a peek at that. And there's like many resources for that as well. The other one is we have the Culturally Linguistic Appropriate Services Task Force. The goal of class is to help reduce health disparities and health equity within the department. So that one just focuses specifically for the Department of Health. However, we do also have the class task force that is just for external partners, which mainly involves the health systems. To address class, we actually do have a toolkit on our OHE website. That is a great resource, so please take a look at that. It will break down what culturally linguistic appropriate services are, how it can be implemented in different ways. The other one is the implicit and explicit biases. The racism and biases, negatively impact and exacerbate health inequities, especially among historically disproportionately marginalized communities. So in order to address that in the Commonwealth, we have a training coming out then for the new year for all healthcare professionals. We're specifically focusing on working with the health systems on that one. And there is also an implicit bias toolkit that just went live at the beginning of this year. We're very excited about that. It addresses many topics, whether it is COVID-19 bias in medicine, refugee and migrant health, and of course, and the LGBTQ community. And we are putting that resources out for healthcare professionals, so that way they understand what implicit and explicit biases are that could potentially affect patient outcomes. And last but not least, we are having our 2024 Health Equity Summit in April 2024 in Harrisburg at the Harrisburg University. So please keep your eyes out for that one, and hopefully you all will be joining us. Thank you.